Hello, I am Dr. Vishwas. I am a doctor of this clinic.
Hello, doctor. Hello, doctor.
Okay. May I confirm your name and age, please?
Yes, doctor. I am David Cameron, 25 years.
Okay, nice to meet you. How can I address you?
You can call me Cameron.
Okay, Mr. Cameron, I came to know that you have rash in your body. Is it right?
Yes, doctor.
Okay, so I am going to take detailed history about your condition, and during our discussion, I will take some notes. But all the information during our discussion will be remain confidential. So, is that okay with you?
Yes, doctor. No problem at all.
Okay, so can you please tell me in more details what is happening with you?
Yes, doctor. Actually, I think I started to having this problem for around the last 2 weeks. Okay. At the beginning, there was this rashes, but now I think that there are some black spots as well. Okay, in that spaces of rashes. So it's bothering me, doctor. And initially it was not spread throughout the body, but as the days are passing by, I think it's spreading more and more to my whole body.
I'm sorry to hear that. And, can you please tell me that where it started first?
Doctor, I think I had some problem initially in my mouth. Okay, then I think it came to the body. So I still have some problem, I think, in my mouth and also in the body, and now it's spreading throughout the body.
Okay, and is it spreading from body to arms or only to the body?
Doctor, different parts of the body, include sometimes arms and legs. Some parts of are also involved. Doctor,
Is it present in the sole and palm?
no, I haven't noticed.
Okay, and can you describe the rashes in more details? Is it fluid filled?
Yeah, doctor, well, that's right. It's actually fluid filled, doctor. It was fluid filled, but then some of it broke down actually. Okay, and now those broke down parts, there are sometimes some blackish. I think sometimes a bit blackish in color. Sometimes some are something are like a bit rough skin now. Okay, in that spaces. So that's really bothering, and I can't go out in front of other people now because of this rash. I feel irritated.
And can you tell me that when it was fluid filled, how would be the size of it?
Not very big, doctor. Somewhere it were different sizes, doctor. Okay,
And was there
some
any
were
other
big,
color?
I didn't notice, doctor. I think it was quite clear fluid.
Okay, and did you ever bleed from that rash?
No, doctor, I didn't notice any bleeding.
Any pain?
Doctor, not that much.
Any changes around that those rash?
No, doctor, I haven't noticed anything
Any
important, significant.
any easing?
Yes, doctor, the rashes that now told that some are black or some are there is some skin condition now. Okay, when they burst out. So I sometimes have some itching in that places.
And did you ever seen any pus or any whitish discharge coming out?
No, doctor.
Did you have any fever?
Well, doctor, not now, doctor.
And before the onset of this rash, did you have any abnormal event like any fever, any diarrhea, or anything else?
No, doctor.
Did you take any medication before the onset of these symptoms?
Doctor, what happened is that I had some small accident. Okay, not a big one, around 1 month back, and they gave me some painkillers for that. And sometimes I take it whenever I feel that pain. Okay, some pain in my legs. I did some scanning, but it were all right. But yet, yeah, there was some pain, and I used to take it whenever I felt pain.
Can you name that medication?
Doctor, I think that medication is ibuprofen.
Okay. And did you take any antibiotic or any other medication?
No, doctor.
Okay. And you said that you have also rash in your mouth, this ulcer. Do you have any problem with eating or drinking?
No, doctor.
Okay. And have you ever vomited out any blood?
No.
How about your bowel habit?
Doctor, it's quite all right.
Have you ever noticed any black stool or any blood in the stool?
Blood stool, no, doctor, never.
Okay. And have you noticed that anything causes this rash more, like any specific food or any specific clothes?
No, doctor, I haven't noticed like that.
Have you exposed to any certain chemicals during this time that you weren't exposed to before?
No.
Any travel recently?
No, doctor. No travel.
Okay. And you haven't had any diarrhea or loose motion recently?
No, doctor.
Have you noticed any uh, weakness or any problem with any in power of your any of your hands or legs?
No, doctor, but for the last 2 or 3 months, sometimes I feel that I am a bit weak.
I'm coming with that later, and I am going to ask you a few general questions.
Okay.
Do you have any headache?
No,
And you said that you don't have any fever.
no.
Okay. Have you noticed any changes in the vision?
Yes, doctor. I told you for the last 2 or 3 months I feel weak, and also sometimes I feel some uh, double vision at times.
When do you feel that?
Doctor, I think I feel it more when I come out from office at home in the evening.
Okay. And you feel better in the morning.
I think so, doctor.
Have you ever seek any medical? Huh? Okay. Have you ever sought any medical attention for that?
No, doctor. I thought that it's due to my weakness or to my tiredness that I sometimes feel this problem. So I didn't take any medical attention for this.
And is the weakness or the changes in the vision increasing gradually?
Yes, doctor. I think so.
Have you ever noticed any shortness of breath,
No,
any chest pain,
no,
any cough,
no,
any lumps or bumps anywhere in your body? Except this
no,
one. Any hot or cold preferences?
no,
Any tummy pain?
no, doctor.
How about your water work?
Doctor, I think it's quite fine.
Any weakness at any specific side of the body?
No, I haven't felt so.
Any joint pain?
No, doctor.
Okay. And may I know that have you ever lost your consciousness?
No, doctor.
And I'm coming to the rash again. Have you noticed the rash changes over time?
Doctor, what do you mean by that?
That over the time it
I
changes its color, shape, or
there
size?
were fluid field. Okay, I told you that sometimes there were fluid field and sometimes it got broken down, and in the broken spaces it was not completely all right. Most of the places there are some skin dryness or some cracking. I think sometimes it's blackish in color, so it's irritating, doctor. That's the changes.
Okay. Do you have any past medical condition that you would like to share?
No, doctor.
Any disease in the liver or any disease in the blood previously?
No,
Any past history of surgery?
no, doctor.
Do you take any medication except ibuprofen?
No,
Any over-the-counter medication or any herbal products?
No.
And do you have any allergy to any medication?
No, doctor.
I am going to ask you a few other questions. It may be distressing, but may I know that do you take any IV drugs or any drugs for your blood channel?
No.
Any recreational medication?
Never. Never.
May I know that any of your family member have any condition that you would like to share?
Doctor, my mother actually has some problem with thyroid gland. That's all.
Okay. And is it okay if I ask you a few personal question?
Yes. No problem.
Okay. Do you smoke cigarette?
Yes, doctor.
How many sticks for how long?
I don't eat sticks for doctor last 10 years.
Okay. Smoking is injurious to health and also related to your condition. So I would like to recommend you stop smoking. And if you need help, I can refer to the smoking cessation clinic. Will it be okay?
Yes, doctor, that would be very helpful.
Okay. And may I know that do you drink alcohol?
Oh, yes.
And any beans drinking anytime?
No, no, no. Just a social drinker, doctor.
Okay. And may I know that what do you do for living?
Doctor, I'm still a university student.
And may I know that do you need think that you need any social help or any economical help?
No, doctor, I think I'm okay.
Okay. May I know that what is your concern this time?
Doctor, what's causing this? It's really irritating, doctor, for my life, and it's not being controlled. So can you please help me out?
I can understand. Is it okay if I ask you a few other questions?
Yes, go ahead, doctor.
Yeah, any of your near on or have you ever recently have you ever contacted with any sick person?
No,
Have you noticed that any sunlight or anything else that causes more stress to your symptom?
no, doctor, I have noticed.
Okay. As I have taken your history, I need to examine you, then I could give you the best explanation. Okay.
Okay, okay,
And at this time, I think that your condition is most likely called erythema multiforme. That can be a possible cause that is associated with ibuprofen taking. There are some other possibilities also, like
okay,
we call pemphigus vulgaris, we call bullous pemphigoid. But to be sure, I need to run some blood test and some snip test of your skin. After that, I can
okay,
that what is happening with you, and also that you have some procrastination. That is, I thinking that there can be some other association condition called myasthenia gravis that can be possible for this diagnosis. Do you get me?
okay, doctor. Okay.
So I'm
So
going.
will I be all right? What do you think?
Okay, actually, first we have to diagnose that what is happening with you. Then we will be sure that it's, what could be done. And I think that these conditions are controllable with medication.
Okay, doctor.
Do you have any question for me?
No, doctor.
Okay. And at this
No
time,
questions.
may I know that do you drive?
Oh yes, doctor.
So I would like to recommend you stop driving until you are sure that what is happening with you. And in the meantime, I think that you need admission for better evaluation and better treatment. Is it all right?
Oh, I will have to be admitted, doctor. It is so serious.
I think that admission, at least observation, will give us more idea and give you the more treatment for that. You may need some medication through your blood channel.
Okay. Is the time over?
Yes.
Okay. So would you like to do some examination?
Yes.
What examination would you like to do?
First, I will ask the patient to expose and to show the lesions. I will see the lesions,
Okay.
their fluid field, if there is any target lesion, if there is any hemorrhage, if there is any pus, if there is any
No target lesions. No
if there is
target lesions, but there are some are crusted lesions, uh, turning some lesions turning a bit blackish, but some are crusted, some are fluid filled, and they are quite flaccid.
okay. And after that, I will try to find out Nicolov's sign if the fluid
Yes, positive.
passes to the through the skin. And after that, I will go for the pulse, any nail changes, and after that, I will
All right, but a bit tachycardic. 110 beats per minute. BP is 90/60.
okay. And after that, I will measure the blood. I like to measure the blood pressure, though it may be it may be impossible because of his rash. So I will go for the eyes for any rash in the eyes, and I will try to find
No
out
rash.
any diplopia and any fatigueness by asking him to look at the ceiling and counting from 1 to 100. I will
Yeah, he's quite problematic. Okay.
okay. And after that, I will assess for the proximal myopathy by asking him raise the hand above the head,
He can do it.
and I'll tell him to hold it there for a few minutes, for a few time to see any droop.
All right. Sorry, drooping.
Yes.
Yeah, there is some drooping.
Okay. After that, I will see into the mouth cavity.
Yes, some rashes, some fluid-filled rashes as well.
Okay. After that, I will listen to the lung if there is any crepitation or any diminished breath sound.
Yeah, no crepitation present, doctor.
Okay. This is now I will ask him to walk if there is any abnormal gait.
No.
Okay, this is the examination I would like to do.
Okay. So, what your the differential diagnosis
For
in
this
this
exam, I
patient
have two
now?
differential diagnosis for his rash. I think it is pemphigus vulgaris, and the other differential can be bullous pemphigoid and erythema multiforme, and as part of Steven-Johnson syndrome. Then
Mm.
can also be part of chickenpox, the one likely without fever. After that, I will for the drooping of eyelid and speech difficulties. I think that this is case of myasthenia gravis.
Yes, yes. So, what do you think can be the cause in this patient?
Okay, for this case, the autoimmune condition like myasthenia gravis and other autoimmune condition like bullous pemphigoid or pemphigus vulgaris, they came.
Yes, yes. Do you think that there is any immediate measurement needed in this patient?
Yes, this patient need immediate hospitalization, assessment for this respiratory function, then urgent medication, urgent immunosuppressive medication like antibiotics, so like steroid and immunoglobulin.
Okay, well, you did you ask about travel history? You just asked about travel history. That's all right. But did you ask about any tick bite history or bite by insect?
No,
Okay, and did you ask about his sexual exposure history? Well,
no, I think I should have asked that little more.
okay, and did you ask about specifically about the redness in the eyes or any rashes in the private parts?
No, I should have asked for that.
Yes, I think you missed some important differentials in this patient. Okay, you have excluded celiac disease, dermatitis, herpetiformis. That's all right. But wherever there is pemphigus vulgaris, and you have also excluded another thing very well. You have excluded porphyria because by asking about sunlight or something like that. You can also ask about whether there is any color change in the waterwork. Okay, because of this type of bullous lesions, the main disease would be, I think, this pemphigus vulgaris, bullous pemphigoid, then IgA disease, linear IgA disease, then dermatitis hermitiformis celiac disease, and sometimes porphyria. So when there is porphyria, so it can be porphyria cutanea tarda. So I think in that case, some blood transfusion history, any history of previous jaundice, and also history of any changes in sunlight, and also any changes in his urine color during water work. Okay, this could have been asked, I think. Okay, are you okay with that? Do you think that is all right?
Yeah.
Yeah, okay. And then others you asked quite well, and you told that there is an autoimmune condition associated myasthenia gravis. Okay, that's very good. So now at this moment, can you please tell me how would you like to investigate the patient?
Okay, the investigator would start with the routine blood test, that is complete blood count to see anemia and white blood cell count level, then inflammatory markers, then liver function test, renal function test, and
Mm.
for routine examination. After that,
Okay.
for myasthenia gravis, some
Mm.
antibodies like acetylcholine receptor antibody, anti-AMUSK antibody,
Mm.
then striated muscle antibody,
Mm.
and after that he's measuring his forced vital capacity, and also blood for immunoglobulin level, and biopsy to skin biopsy to find out the
Yeah. Okay. 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 So that's very good. And now, okay, that's very good. Now, can you please tell me that how would you manage this patient?
Okay, this is a multidisciplinary approach. First, this patient needs admission, hospital admission, then maintenance of his fluid status, and then support other supportive treatment, and involvement of the multidisciplinary team, like involvement of the dermatologist, involvement of the rheumatologist, and a specialist nurse for myasthenia gravis and this skin condition, then involvement of my consultant, involvement of the physiotherapist.
Okay, well, but do you think that any psychiatric help should be given? He has repeatedly told that he feels embarrassed going out, and this type of patients, I think, sometimes need some psychiatric help as well.
Okay, at
Okay,
this
for their appearance.
emergency situation, I don't think that he will need psychiatric association at this stage.
Okay, okay, that's all right. And in the investigation part, I think you have covered most of it well. One thing I just can't remember at this moment. Okay, that's all right. And you told about, did you told about skin biopsy?
Yeah.
Yes, I think you told. Okay. And skin biopsy. Okay. And did you tell about any blood culture? Because you have seen that the patient has some raised pulse rate and decreased BP. So don't you think that secondary infection may be present in this patient, although he does not have raised temperature at this moment? But there can be some secondary infection. Okay. So don't you think that blood culture can be done?
Yes, blood culture. Blood should be sent for culture.
Yes, I think that that's an important point according to the patient's clinical findings. Okay, since the patient has some features of shock. Okay, so I think that's the discussion. Do you yourself want to add anything more?
No.
Okay, so thank you. Have you stopped recording?